If you receive Social Security, do not only look at the number on your check, look at what Medicare may be taking out before you even feel that money. Because for many seniors, the real problem is not just how much Social Security pays. The real problem is how much of that money they actually keep after Medicare costs. Part B premiums, Part D drug plan costs, higher income Medicare charges, deductibles, copays, and missed help programs that many seniors never check. This is not fake free money. This is not a promise that every senior can lower their costs. But if you are on Medicare, one thing is true. Medicare costs can quietly reduce what you keep from your Social Security check every single month. And if you do not review them, you may keep paying more than you needed to. Today we are going through the Medicare costs seniors should check, why they matter, and which programs may help if you qualify. Stay with me because number 5 is the one many seniors ignore until their check already feels too small. The first cost to check is your Medicare Part B premium. This is the main Medicare cost many seniors notice first. Part B covers things like doctor visits, outpatient care, some preventive services, medical equipment, and other medical services. But Part B is not free. Most people pay a monthly Part B premium. And in 2026, the standard Part B premium is over $200 per month. That means before you even think about groceries, rent, medicine, electricity, or gas, Medicare may already be taking a serious piece of your monthly income. For a senior living on a fixed income, that matters. A small increase in Medicare costs can feel like a cut in your Social Security check. You may hear that Social Security got a cost of living increase, but then you look at your real deposit and ask, why does it still feel low? One reason may be Medicare deductions. Your action step is simple. Look at your Social Security payment details. Check how much is being deducted for Medicare. Part B, do not guess. Do not just look at the deposit amount. Look at the full breakdown. The second cost to check is your Medicare Part D drug coverage. Part D helps with prescription drugs, but the cost depends on your plan. Some seniors pay a monthly premium, some pay deductibles, some pay copays, some pay co-insurance, and sometimes a drug that was affordable last year becomes more expensive this year because the plan changed, the pharmacy changed, or the drug moved to a different tier. This is where many seniors lose money quietly. They stay with the same drug plan year after year because they do not want to deal with paperwork. But their medicine list changes, their plan changes, their pharmacy prices change, and by the time they notice, they may already be paying more every month. Your action step is this. Write down every prescription you take, then compare your Part D plan costs during the Medicare review period. Check the premium, check the deductible, check the pharmacy, check whether your drugs are still covered, and check whether a different plan could reduce your total yearly cost. Do not only look at the monthly premium. A cheaper premium can still cost more if your drugs are expensive inside that plan. The third cost to check is IRMAA. IRMAA stands for Income-Related Monthly Adjustment Amount. This is an extra Medicare charge for people whose income is above certain limits. Many seniors do not understand this because IRMAA is not based on what they feel their income is right now. It is often based on tax information from 2 years earlier. That means a one-time income spike can sometimes create a higher Medicare premium later. For example, selling property, taking a large retirement account withdrawal, doing a large conversion, or having unusually high income in 1 year may affect Medicare premiums later. This does not mean everyone will pay IRMAA. Most seniors will not. But the seniors who do pay it can be shocked when they see their Medicare cost increase. And if that higher Medicare charge is connected to your Social Security payment, it can feel like your check got smaller. Your action step is this. If your Medicare premium suddenly goes up, do not ignore the letter. Read the reason. Check which tax year was used. And if your income dropped because of a life-changing event, such as retirement, work reduction, divorce, marriage, or death of a spouse, ask Social Security about the IRMAA review process. Do not assume the amount is permanent. The fourth cost to check is Medicare Advantage or supplemental plan costs. Some seniors have original Medicare, some have Medicare Advantage, some have Medigap, some have Part D. The monthly cost can look different depending on your setup. A plan may have a low premium, but higher out-of-pocket costs. Another plan may have a higher premium, but lower costs when you actually use care. Some plans may include drug coverage, some may not. Some networks may work well for your doctors, some may not. This is why seniors should not choose a plan only because the premium looks cheap. The real question is, What does this plan cost me for the care I actually use? Doctor visits, specialists, hospitals, prescriptions, pharmacy access, dental, vision, or hearing extras, transportation, out-of-pocket limits, and whether your doctors are still in network. Your action step is this. Review your plan every year, even if you like it. Check your doctors, check your drugs, check your total yearly cost, check the network, and check what changes next year. A plan that worked last year may not be the best plan this year. The fifth thing to check is whether you qualify for help paying Medicare costs. This is the part many seniors never check. They think, I probably make too much. Or, I already have Medicare, so there is nothing else. Or, nobody told me I could apply. But Medicare has cost help programs that may help people with limited income and resources. Medicare savings programs may help pay Part A and Part B premiums, and depending on the program, may help with deductibles, co-insurance, and co-payments. Extra help may help lower prescription drug costs under Part D. This does not mean everyone qualifies, but it does mean you should not reject yourself before you check. Some states have different rules. Some states may count income or resources differently, and Medicare itself says that even if you do not think you qualify, it can still be worth applying. Your action step is this. Search for Medicare savings program in your state. Also search for extra help for Medicare Part D. If you have low income, limited resources, high drug costs, or your Social Security check feels too small after Medicare deductions, this is one of the most important things to review. The sixth cost to check is late enrollment penalties. This one can hurt for a long time. If you do not sign up for certain parts of Medicare when you are first eligible and you do not have qualifying coverage, you may face penalties. A Part B penalty can last as long as you have Part B. A Part D penalty can also follow you if you go too long without creditable drug coverage. Many seniors do not realize this until it is already added to their premium. Sometimes people delay Medicare because they are still working. Sometimes that is fine if they have proper employer coverage, but sometimes people delay without understanding the rules. That can create a penalty later. Your action step is this. If you are near age 65, or if you delayed Medicare because of work coverage, confirm your enrollment window before you make a decision. Do not rely only on a friend's advice. Do not rely only on what happened to your spouse. Check your own situation. The seventh thing to check is your real monthly number. This is the number that matters most, not the gross Social Security amount, not the amount before Medicare, not the number you saw in a headline. Your real number is what you actually keep after Medicare costs. So take one piece of paper and write it down. Start with your Social Security benefit amount, subtract Medicare Part B, subtract any Part D premium, subtract any Medicare Advantage or Medigap premium if you have one, subtract any IRMAA charge if it applies. Then look at what is left. That is the real amount you are living on. This is the number seniors need to understand, because if you only look at the gross check, you may not see the real pressure. But when you look at the deductions, you can start asking better questions. Can I review my drug plan? Can I check for extra help? Can I apply for a Medicare savings program? Can I review IRMAA if my income dropped? Can I compare plans during the right enrollment period? Can I avoid penalties by signing up correctly? Now let's bring this together. Medicare can reduce what seniors actually keep from Social Security through Part B premiums, drug plan costs, higher income charges, plan premiums, deductibles, copays, and penalties. Not every senior can lower these costs, but every senior should check them, because ignoring Medicare costs will not make them disappear, and guessing can cost you money every month. So before you assume your Social Security check is simply too low, review what Medicare is taking out and what help programs may exist. Check your Part B premium, check your Part D plan, check IRMAA, check your Medicare plan costs, check Medicare savings programs, check extra help, and check your real monthly number after deductions. If this helped you, please subscribe to my channel for more clear updates for seniors, Social Security, Medicare, retirement money, benefits, and important changes that can affect daily life. Also comment below, do Medicare costs take money from your Social Security check every month? And comment Medicare if you want a simple checklist of what to review before your next payment.